And now our final panelist of the day is Dr. Andre Saine of the Canadian Academy of Homeopathy.
I will now present the epidemiological evidence for homeopathy, which, despite being very compelling, is one of the most ignored chapters in the history of medicine. With more than 25,000 volumes, the homeopathic literature is very rich in reports about the results obtained by homeopathy during epidemics. A review of this extensive documentation cannot help but leave even the most skeptical among us astonished by the results reported by generations of homeopathic physicians throughout the world. I will now present some of the main findings of this literature review. First, results obtained by homeopathy during epidemics reveal a very clear and constancy, important and clear constancy, namely a very low mortality rate. This constancy remains regardless of the physician, institution, time, place, or type of epidemical disease, including disease carrying a very high mortality rate such as cholera, smallpox, diphtheria, typhoid fever, yellow fever, and pneumonia. Second, this low mortality rate is always superior to the result obtained by the allopathy practice at that particular time, and as a rule, the allopathy of today, despite to the additional advantage of modern nursing care, such as hydration. Third, the greater the success obtained by homeopathy, the greater the disbelief of allopaths, the greater the repression direct towards homeopathic physician, and the more forcefully homeopathy was ridiculed and proscribed. Fourth, despite well-documented and official reports, the results obtained by homeopathy have been almost completely ignored by the scientific and medical communities as if they had occurred in a void of time and space. I will now give 5 examples to illustrate these results. First, let's look at cholera. When cholera first invaded Europe in 1831, the mortality throughout Europe was generally between 40 and 60%. To the surprise of many, mortality rates reported by homeopathic physicians was generally below 10% and commonly under 4%. I will now present 2 typical cholera reports which have a stamp of officiality. The first one comes from the territory of Rab in Hungary, where in 1831 a Dr. Joseph Bakudi treated 223 patients with mild to severe cholera, 14 of which were in a state of collapse. He lost a total of 8 patients, a mortality of 3.6%. However, he was accused by the allopaths of having treated only 8 patients and having lost all of them. In response, he placed his official report containing the names and addresses of the patient treated in the public archives of the Imperial Health Commissioner. As a result, Dr. Bakudi was able to save his honor and that of homeopathy by testimonial judicially attested. Moreover, an allopath complained to the municipal board that Dr. Bakudi was preventing real medicine from delivering its beneficiary effect and suggested that Dr. Bakudi be imprisoned until the epidemic was over. Fortunately, facts spoke louder than prejudice. The epidemic was so severe that all the physicians in the area became occupied by it. At first, Dr. Bakudi, the only homeopathic physician in the area, treated homeopathically mostly desperate cases after they had received allopathic treatment. He obtained such an astounding success that people called on him for treatment in large number. Unfortunately, Bakudi was unable to treat all the ones in need and was obliged to turn patients down. The result, a petition was presented by the citizens to the government officials requesting all physicians to adopt homeopathic treatment for the rest of the epidemic. However, the regional health officer blocked the publication of the petition in the local press. A similar situation occurred in Cincinnati in 1849 when cholera invaded this thriving city of 110,000 souls. The Board of Health issued an order calling for physicians to report all cases of cholera. Reports of a high mortality rate were received by the board from the city hospital and allopathic physicians. However, 6 homeopathic physicians attracted national attention when they report not a single death out of their first 350 cases of cholera. 2 of these homeopathic physicians, Dr. Pulte and Herman, would eventually report treating 2,646 cases with 35 deaths or a mortality rate of 1.3%. Allopaths report fatal outcomes in the 50% range. Of course, Dr. Pulte and Herman were accused of having provided false report of mortality by an allopath who was editorial of a periodical. He claimed that homeopathy was merely a name used to cover the regular practice of allopathic medicine. A commission was called to investigate the accusation. One of the two commissioners was a prominent lawyer, Mr. Alphonse Taft, who would eventually serve as Secretary of War under President Ulysses S. Grant, and whose son, William Howard Taft, would become the 27th President of the United States. The report of this commission completely exonerated the homeopathic physicians. Now, let's move on to the second example, and let's look at pneumonia, whose incidence and virulence has remained quite uniform throughout time. Before the era of antibiotics, the average death rate from pneumonia was 30%. Since the introduction of antibiotics, the death rate has only gone down to 18%, which means that 7% or 1 American in 14 today, will die today of pneumonia or the influenza complex. On the other hand, the death rate under genuine homeopathic treatment has always been less than 1 to 3%, even in patients suffering from the most fulminant type of pneumonia. This is simply astounding if true. But just in case these reports are not sufficient to stimulate your interest in homeopathy, let's push our inquiry a bit further and let's look at the most fatal of all infectious disease, namely rabies. Virtually 100% fatal once symptoms develop. The Center for Disease Control in Atlanta report that only 6 cases of rabies have survived. They note that 5 of these 6 cases received pre-exposure or post-exposure prophylaxis in the asymptomatic phase before developing rabies. But according to the CDC, for the first time ever, in the fall of 2004, 1 case survived rabies without having received these prophylaxis. This case involved a teenage girl in Wisconsin and was heralded as a great advance in medicine. She was in intensive care for close to 6 weeks. Indeed, she survived rabies, but like the other 5 survivors, remains severely and permanently handicapped. Therefore, according to the CDC, only 6 individuals have survived rabies, but no one has ever recovered from it. On the other hand, I have been able to document more than a dozen well-described cases of unmistakable, fully developed clinical rabies, and that had uneventful recoveries under homeopathy, and this without any prophylaxis whatsoever to assuage the virulence of the disease. What is even more interesting is despite the fact that homeopathic treatment was started late in the course of the disease, in each case, recovery was quick and complete. There was no need for these patients to spend weeks in an intensive care unit, no need to provoke in them a deep coma with 2 anesthetics to slow down the activity of their brains, and most importantly, there were no apparent long-term sequelae under homeopathic treatment. If this were true, why and at what cost were these facts completely ignored by the entire scientific and medical establishment? This small sample of reports should be sufficient to illustrate the potential of homeopathy and incite real scientists, honest physicians, and intelligent people to examine homeopathy more seriously.